By the end of this video, you will be ready to start your 7 to 10 days long treatment, self-treatment, which could possibly heal or at least considerably alleviate much more sicknesses than most people would have expected. You would need some 20 to 30 minutes per day. And even though those who suffer from chronic or complex ailments may need more than one such 7 or 10 day treatments after a break of a week in between them, still even they should be experiencing considerable improvement after the first 10-day treatment period. Acupressure is based on the ancient knowledge of the channels in which the vital energy flows through the human body, and a precise knowledge about the points at which this energy can get blocked, which in its turn manifests into what we call sicknesses. Once the blockages are removed, the sicknesses will quickly vanish by themselves. And the beauty of the method which I'm gonna teach you in this video is that you don't need to spend a couple of years in detailed study of all the complex meridians and paths through which the energy flows, or the countless points, the pressure point, Changchu Qian and Inku Yan, and so on. Because to be healthy, you need to have all blockages removed, even those of the minor and so-called unimportant points. Imagine a stream of water, for example. It doesn't matter at which spot exactly on this stream some twigs and leaves will create a small blockage. If that grows, gradually it will prevent the flow of water. Things will start to rot and smell around this spot where the water is not getting properly flushed. And at the end, it doesn't matter at all was the original spot where all this started important or not. In the same way, a blockage, even at a minor point in the human body, can cause a major sickness, and eventually this rotting can spread to the entire body. And since removing blockages from the points is relatively easy and is harmless when done properly, it is far more beneficial to get straight to the job instead of philosophizing or going to lengthy courses, which also requires energy. In addition, when you do the treatment, you on yourself, you're already in an advantageous position because the amount of pressure applied during treatment is extremely important. No matter how good an experienced the therapist is and how well he communicates with the patient, still it is extremely unlikely that he will be able to feel exactly what you feel. And you're the one who really knows how much is this ideal pressure of feeling some sort of slight pain, but not unbearable discomfort. If the pressure is too less or too little, the healing may not take place. That's why never forget that pressing too much, bruising yourself, will not heal you faster, or it may not heal you at all. The size of these energy crossways, or the points, is that of a small coin, a dime, let's say. And usually the pressure would be applied with your your hand, or you can use some sort of tool. This is a simple homemade tool. Both ends can be used depending on what kind of pressure you want to apply. You can also use some sort of pen or pencil as well. When you work on a given point, don't spend more than a couple of minutes on it. First, you can start with light rubbing or general massage, and then you can press it and release it as it was shown earlier, or you can simply press continuously as well. Do not use any tools near your eyes. There are many points around the eyes. Use your fingers and position them in such a way that even if they slip accidentally, they will not hurt your eyes. And before discussing with which points are we gonna start, I would like to mention 3 very important points. Sometimes when a given point is very badly blocked, then when you start looking for points, there will be an entire very big area the size of your palm, which will be quite sensitive. They will hurt when you start looking for points, and this may confuse somebody who is not experienced, because he will think, come on, so do I have like 20 points all rotten next to each other? This is gonna take ages. And the situation may look desperate, but what has actually happened most likely is that when one single point is blocked like this, the entire area around it hurts a lot, and one cannot even find the point. This is not at all a reason to get discouraged. Just continue to rub and press as much as you can the entire area, and much to your surprise, within a couple of days, first of all, the pain will get localized to the point from which this disbalanced energy was spreading, and then it will disappear probably completely by the end of the 7 to 10 days treatment. Some people can have a number of such points, and it may look hopeless in the beginning, like, okay, how can I treat points on my body if my entire body aches? It may seem that point pressure, acupressure, is not applicable for cases where all points are rotten, but actually it only looks like that. They're not all rotten or blocked. It is just big areas blocked by a single point, and again applying this very simple method within few days, that will clear. No matter if a given point has an overflow or not, it is very likely that if you start working on it on the second or third day, it may get actually worse, more sensitive, more tender. This is normal. This is part of the treatment. It is only a sign that it works, and in no way should be a reason for getting discouraged. So when you start your treatment, decide how much time you can devote every day, let's say 15 minutes or half an hour, and then see how many points you can cover in that much time. During this first 10 days treatment, you should be working on the same points every day, and you should not be missing a day. It's not like, okay, today I did something, this is natural treatment, in a few days I will do again, let's take it slow, let's take rest. No. You should not interrupt your treatment, and you should do it daily. There will be no harm if you interrupt it or if you stop in the middle, but you will simply not get the effect if you, let's say, do it every other day for 20 days. Traditionally, in China, the acupressure was done like this, every day for a week or a bit more, and this is how it should be. This is how it works. After that, you can have a week or 10 days rest, and if needed, you start with another set of points. And continue in this way until there are no more blockages in your body. But you will not feel it as a burden, because you should be feeling the improvements already after the first course of 7 or 10 days. It's not that you have to wait months to feel any result. If you're not feeling an improvement after you have done a week, let's say, of treatment, and then you have allowed a week more for your body to adjust to the new flow of energy, if you still don't have a tangible improvement, that means that either you're doing something wrong or acupressure is simply not the suitable modality for the problem you have. Because there are no incurable diseases, absolutely, but there are certain people who cannot be healed at given moments of time, or it is extremely difficult. This I'm gonna be addressing in future videos, not in this one. And in addition to that, sometimes treatments done in winter or even in autumn may not be as effective as those done in spring or summer. And if you're not having satisfactory results in the colder seasons, when the points are considered to go deep and almost kind of hide inside the body, then you could try again in spring. Maybe it is the season. Okay, now next is how to locate the points precisely and how to select the best set of points for your first 1 week treatment. Locating a point is very easy. When you press there, it hurts. It is as simple as that. Now, you may not know what is the exact name of this point, to which meridian it belongs, to what condition it might be connected. And the beauty of what I'm proposing here as a method for applying acupressure is that you don't have to. That is for professionals. When you just wanna cure yourself, it will take you much longer time to delve into acupressure literature trying to figure out the points than healing yourself. You don't have to know the exotic name of the point which you're healing, and the beauty of all this is that you don't need even an exact diagnosis at all. You simply have to remove all blockages from all points on your body. In case you already have some sort of diagnosis that you trust, you may take it as a kind of orientation, and for example, you can start looking for points in the area near to the affected organ or on the meridian which is connected with this organ. So these are some charts with some of the main meridians, or let's say rivers for vital energy flow around your body, but you don't have to study them. For example, if you decide to look for the points that you see on a given meridian, that is fine. But there are so many points that sometimes when you look for the one shown on the chart, you may actually find another one which hurts, and the one you are actually looking for is not blocked, and that's why you cannot find it. It doesn't hurt. You don't need to find it anyway. Also, there are some areas where the points are clustered in such a way that it is very hard to understand which point exactly is where, but again, you don't need to. You just apply treatment to all points that are blocked. It will not take forever, it will not take ages, because once you start unblocking points, they in their turn, as the energy starts flowing in a new way, that will also unblock some points even without you doing anything about it. Besides the meridians shown here, there are areas which are just full of points, and I'm sure you know about them. These are the feet, both the soles and the top part, all the way to the ankles. The palms, again, downside and upside, including the wrists. And then the entire head, the face, the backside of the neck, all of that is one point for acupressure next to another. The ears as well, very high concentration. Possible problem that some people may encounter. Let's say you're convinced that your kidneys are sick and you try to find some points related to them, but you don't find any blocked points. There could be many reasons for that. But instead of trying to figure out what is the exact reason in your case, it will be far more beneficial to find any other blocked points and work on them, instead of trying desperately to locate kidney-related problems and pressing them even though they are not even blocked. So some people might be wondering, if I want to do acupressure the right way, the best way, isn't it better after all to go to professional who knows all the points very well and who will do a treatment specific for my condition? The answer will not be always the same for all circumstances. If you can go to a proper trained healer for only one day, then it is better that do it yourself, but for 10 days continuously. But if you can arrange 10 days continuous visits to a professional, then maybe that may work well, especially if you are properly diagnosed, which doesn't happen very often in modern times. Acupressure can heal pretty much almost all sicknesses, but it may not heal all people, and that's why I'll be making at least couple of more videos about other more advanced healing modalities.